Upstate Medical University in Syracuse, New York invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Pediatrician Steven Blatt has been caring for children for more than 40 years, and so he's very knowledgeable about vaccine-preventable illness and childhood immunization. The federal government is no longer broadly recommending several childhood vaccines that many pediatricians still recommend. So I'm talking with Dr. Blatt for his advice about what parents should do. Dr. Blatt is a professor of pediatrics who oversees the General Pediatrics Division at Upstate. Welcome back to The Informed Patient, Dr. Blatt.
Thank you. It's great to join you.
Now, the new federal guidelines make the United States more like some other countries that recommend fewer shots for children. Are vaccine guidelines meant to be specific to human beings or to geographic locations?
Vaccines are really more specific for patients, but I'm actually going to go back to your original statement because I think there's a lot of confusion as to what recommendations mean. So you said the CDC changed their recommendations, but let's even back up and talk about how vaccines get from, somebody coming up with a new vaccine to pharmaceuticals to getting into the arm of the patient. So the pharmaceutical companies come up with a new vaccine and they test it, and the Federal Drug Administration, the FDA, oversees that. And they go through a lot of rigorous testing in different stages. And then eventually, when those vaccines are approved by the FDA, eventually it will make its way to the CDC, the Center for Disease Control. And there is a committee called the Advisory Committee on Immunization Practices. And until about a year ago, that committee was comprised of experts from the American Academy of Pediatrics, the American Academy of Family Practitioners, the group representing obstetricians and gynecologists, the group representing midwives, nurse practitioners, and I think I left one group out, which I apologize for, but it was broad representation, as well as some government scientists. So ACIP would make recommendations, and then the recommendations would lead to a unified immunization schedule. And with that endorsement by ACIP and the CDC, that would lead to insurance companies and Vaccine for Children, which is a federal agency that provides vaccines to kids on Medicaid and Child Health Plus, and those that don't have insurance. It will lead to those organizations for paying for vaccines. So those were the recommendations, but it doesn't end there. Before you get to your original question about geography, because in a sense, geography does play a role, because every state has the ability, and they all act upon it, to require immunizations for daycare and for school. So the recommendations are one, but the law in each state varies. And so that's important to understand. So what's recommended in New York State could be different than what's recommended in Mississippi or California or wherever. And not only that, within each state, there are, for lack of a better term, opportunities for a patient to opt out of those requirements. So in most states, a patient can claim a religious exemption and state that my religion prohibits me from obtaining that vaccine. And until about 7 years ago, that was available in New York State. But since, 7, 8 years ago, in New York State, the only exemption from the vaccines is a medical exemption. That is, if the patient got the vaccine, it would be dangerous for the patient. So if the patient was immunocompromised. So those are the requirements to go to school. And that's different than the recommendation that comes from the federal government. There are some variations in geography as to what kids need. But in terms of I think what you're asking about geography is why are recommendations different in different parts of the world? And I don't have an exact answer for every country why they differ, but I'm sure a lot of it has to do with economics, who's paying for it. 40 years ago, parents paid for it, and Medicaid paid for some of it. So in some countries, they may just choose not to do it. I know many years ago, Japan and England decided not to use the DTaP vaccine because they were concerned about side effects, and the US did. It's not that there were differences, people had different concerns. So there's no real difference in geography, but there are differences in economics and just viewpoints and politics and all that. So it was a long answer to a simple question.
Well, but it brings up a good point about the differences in the states. Has New York State altered the vaccine requirements for school attendance in response to these federal changes, or do you know if any states have?
So in terms of the federal changes, over the last year, with a new presidential administration, as happens with every new presidential administration, there are new administrators throughout the federal government. And the people in charge of health and human services and the different agencies have a different viewpoint about a lot of medical type things, about how it should be approached. And many states have said very clearly, we're going to continue to do what we did before the political change. New York is one of those states. Many of those states have banded together to form a consortium. And so in the Northeast, I think most of those states have joined that group and said, we're going to continue doing what we did before. On the CDC website, what it states is that the immunizations that were covered in the past before the change in administration in January of 2025, all of those will be continued to be paid for by the Affordable Care Act, vaccine for children, by Medicaid, by private insurance. They said that's still going to be paid for. They're just not going to recommend them the same way. So as of today, the financial situation has not changed. Vaccines will still be paid for. So the question is, then what's the change? So if they're still going to pay for them, what's the change? And I think there are two components of the change. One is, and we can come back to it in a few minutes, there's some vaccines that they're not recommending anymore. And then there are other vaccines that they are. That's one change. But the CDC website says for the basic vaccines, we're going to do what most of the world does. But what we want to do is promote healthcare providers and patients collaborating as to what vaccines they're going to get. So, for example, prior to this past year, when newborns were in the hospital, certainly in central New York, and I suspect in most places across the country, hospitals would follow the recommendation and immunize children with hepatitis B. And then, so the first hepatitis B vaccine would be in the nursery. And that was one of the vaccines that was taken off the recommended list. And the CDC said it's still available. Children could still get it. They don't think it's required as a newborn. And we could talk if you want later about why others disagree. But they said doctors and other healthcare professionals should talk with the patient about whether they should get it or not. Well, the reality is we always talk to the patients about what they were getting, whether in the hospital or in the office. You know, forever we have said, you know, for your 2-month-old today, your newborn today, your 15-year-old today, this is what is recommended. This is what I personally recommend. Can I give this vaccine to your child? Just prior to this discussion, I walked out of a patient room with 2-month-old and I just had that same talk. That hasn't changed at all. We've always done that. You know, that doctors, you know, don't force people into treatment. We say, this is our recommendation. So that really hasn't changed. I think what's changed is with the federal government changing the recommendations, it's suggesting that maybe you don't need these vaccines. So that's what's really changed. They put in some doubt to say, well, do I really need these vaccines? So that's what the change is from the federal government.
So maybe your conversation is changing a little, or you're adding to it with parents to explain whether and why you think a vaccine is necessary.
That's correct. And let me describe how that changes. So in the past, I would say, congratulations on your baby. And actually, this vaccine usually happens in the delivery room because time is of the essence in case the mother has hepatitis B. But we would say, you know, hepatitis B vaccine is recommended. I want to give it to your baby. What do you think? Do you have questions? And most people would say, that's fine. Now people know that it's not quote unquote recommended. So they say, well, I don't want it now, or why do I need to get it? So now, and it's become pretty common, at least in central New York, you know, people say, well, explain to me why I need it. And I say, sure. And it's a 15-minute discussion because I want to do it the right way. And then some of them say, go ahead, give it to me. Some say no. And that happens a lot now. And, you know, I was in the nursery about a month ago, and I think 2 of my 4 babies, the parents wanted that explanation. So I give them that explanation. And last night I was at a meeting with the Pediatric Society of Central New York, and it was pretty common for people to say all day long in the office, we're having those discussions. And we want people to be informed, but now we're not really talking about why you need vaccines. It's kind of like, why is this even an issue now? So it's a different type of discussion. And as part of the answer is, no, you don't need it today. But if you want to send your brand new baby to daycare in 2 months, you need it then. Or if you want to send your brand new baby to kindergarten, you're going to need it then. And so for most of the kids, unless they homeschool, eventually they're going to need it. So it's a new discussion, not so much on the vaccines, but more of the logistics of the vaccine.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Steven Blatt, who oversees the General Pediatrics Division at Upstate. So I want to talk to you about the vaccines that the government has dropped from the recommendation list, starting with the annual flu shot. This year in particular seems to be a rough year for flu. How do babies and children usually fare when it comes to the flu? And do you still recommend a flu vaccine every year?
So we'll talk about first, how do babies and children do with the flu? So babies and children, you know, do better than adults with the flu. They always have. And the thing that I think people don't recognize is how much flu is out there and how sick kids could get with it. This happens to be a very bad year for flu in that there's a lot of flu. And we got hit really hard. The amount of flu is a little bit less than it was 2-3 weeks ago. And New York State sends out weekly updates to all of the physicians to see what's going on. So that's getting a little bit better. But every year there are lots of kids that get hospitalized, and there are some kids that die from it. So it's not nothing. Kids get really sick with flu and kids die from it. The flu vaccine is, of all the vaccines, it is probably the least effective. And that's because every year the strain of flu changes. And 10 months before flu season, researchers have to figure out what are we going to have in 10 months. And sometimes they guess right, sometimes they guess a little wrong. But even when it's not a good match, the flu vaccine does help. It lessens the impact of the actual flu disease. So, yes, it's needed. Yes, the vaccine is not perfect, but it does help most people, and it helps kids better than it helps adults. And it can be a really bad disease.
Is it for children from birth on up, or do you
So,
start at a
so
certain age?
yes, we recommend it. And the youngest age that you can get is at 6 months.
Now let's talk about hepatitis. You already mentioned the hepatitis B vaccine that's given sometimes in the delivery room, but at birth. Are hepatitis A and B still recommended, or did both of them get removed?
The CDC did remove hepatitis B and hepatitis A. For New York State, hepatitis B has always been on there. So to go to a New York State daycare facility, preschool and school, you need hepatitis B. Hepatitis A was recommended. I don't believe it was required the same way. One of the reasons that was cited for removing the hepatitis B is that hepatitis B is transmitted through blood, which means it could also be transmitted sexually. And people said, well, if we know the mother doesn't have hepatitis B, we don't need it now. And the baby's not going to have sex for many years, so everything's fine. We don't have to do it now. The problem is we don't always know the mother's status, number one. Number two, we don't know who an infant is going to have sex with when they get older, or what kind of needles they're going to use. If they're unfortunately using illicit drugs, they could use needles and transmit it that way. And it's so many years removed from birth, nobody's going to remember when they're 15 or 20 or 25, oh, I got a hepatitis B shot. And like most of the vaccines that we have, the illnesses that they prevent, people don't see them anymore, so they don't believe it's a problem. When you look at all of the vaccines that we give, and you look at hepatitis B as one of them, very few people know anybody who has bad effects from hepatitis B. And what are the bad effects? It destroys your liver and you need a liver transplant. So by the time you realize that you have chronic hepatitis B, and then God forbid a liver transplant, it's too late to do anything. And when you look at hepatitis B, it's really disappeared because of the hepatitis B vaccine. And that's why people don't see it. But once we stop vaccinating people, the rate's going to go way back up. And that's with every vaccine on this list. And all of those diseases, they're all really bad diseases. And people don't know it because they don't see them.
Are people not realizing that giving the vaccine at birth confers immunity for many years, many decades?
I'm not sure what people realize who are making these decisions. I do know that my colleagues, both locally and nationally, we realize it, and that's why I'm choosing my words carefully. We're distraught over this. We've spent our lives taking care of people with terrible diseases. As you mentioned in the beginning, you told everybody I'm old. I've been doing this for 40 years. 40 years ago, when I was a resident at Upstate, I saw children with meningitis. I saw kids with pertussis admitted to the hospital with varicella, with measles. I didn't see kids with polio, but I have seen people who have suffered polio. Haemophilus influenza B, I've seen with pneumococcal pneumonia, meningitis, and pneumococcal pneumonia. And these have almost disappeared. My residents never see these illnesses. I mean, I saw all of them, so it's almost like it's because how successful these vaccines are, why people don't remember them.
Well, let's move into meningitis. This is a bacterial infection. What can you tell us about the vaccines that guard against meningitis?
So we have 3 vaccines that we use to prevent meningitis. One of them is pneumococcal vaccine, and the trade name is Prevnar, and that prevents pneumococcal meningitis. It also helps prevent bacterial pneumonia from pneumococcus, and the elderly take that vaccine also. So it's for young kids and for the elderly, and that works very well. And it has, when I say something has virtually no side effects, I mean, it means they're very, very rare. Doesn't mean never. I think that's always an overstatement, but virtually never has any side effects. I think I said there were 3, but there are probably more. I'm not counting right. There's Haemophilus influenza B, or HIB, and that was primarily in young children. It also caused epiglottitis, and swelling of the epiglottis in the throat. And these are illnesses that made kids deathly ill, and many kids died from this, and other kids ended up with lifelong disability. There are 2, they're called the meningococcal vaccines. One is for 4 different strains, and then there's another one for a 5th strain. And those are more for the older kids, the teenagers. Meningitis, just to be clear, means that there's an infection in the central nervous system, a bacterial infection in the brain. And maybe a way to think about this is think how much your throat hurts when you get a strep throat, a bacterial infection of your throat. Now imagine that on your brain, that pain in your brain. That type of infection would kill children and make them, or if they survive, to make them debilitated for life. And when I was a resident, we had 1 or 2 kids admitted to the hospital every month with bacterial meningitis. Now we have a case of bacterial meningitis once every couple years. I mean, it's these vaccines work great, and we're worried those type of illnesses are going to return.
Because if someone doesn't get vaccinated and they get meningitis, they can spread it to other people, right?
Some of the types of meningitis are somewhat contagious. Most of them are not very contagious. Some are. If we contrast it with some of the other illnesses such as measles, chickenpox, those are very contagious. The thing about the meningitis, it was always uncommon, but it was devastating. So the vaccines typically fall into a couple of groups. Sometimes they're devastating illnesses that were uncommon, but if you got it, it was devastating. And then there are others that are much more common, but not as severe for most people, like the flu or rotavirus. Before we had rotavirus vaccine, we admitted kids to the hospital day and night for diarrhea during the rotavirus season. And as long as I'm mentioning that vaccine, my new favorite vaccine is nirsevimab. And nirsevimab is an antibody vaccine that is used for infants to prevent respiratory syncytial virus or RSV. And one of the primary researchers on that is our colleague, Dr. Joe Domikowski, who immunized the first children in the world with nirsevimab here about 5 years or so ago. And RSV is the leading cause of hospitalization and time in the ICU for infants. And that occurs the most in the first 2 months of life. So that's a vaccine we want to give in the nursery. And that's brand new. And I was just looking, as I look every week at the rates of these illnesses sent out by New York State, this year compared to last year, the amount of RSV is about half, it looks like, in the community. And it's because this is a new vaccine. And I think every year we're getting less and less of it as we have more and more kids immunized against it. And this is another vaccine, a different form that they use for adults, but the same type of idea.
You mentioned rotavirus. That used to be the leading cause of severe diarrhea, right? Before the vaccine came out.
Absolutely, yes.
So what else can you tell us about rotavirus? Is the vaccine effective?
Again, 40 years ago, we could admit 2 or 3 kids a night with rotavirus. You know, they would come in and the story would be they're 2 months old, 6 months old, and they've been having profuse diarrhea nonstop and vomiting nonstop. And the kids are dehydrated. They get admitted, have an IV put in, and then most of them in 2 or 3 days, they'd get better. It would take a while for their intestines to recover, and then they'd go home. My residents never admit a baby with rotavirus now. It just doesn't happen because the vaccine works so well. It's a great vaccine. It happens to be an oral vaccine, which people like because it's one less needle.
You're listening to Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Dr. Steven Blatt, who oversees the General Pediatrics Division at Upstate. I want to ask you about the HPV vaccine because the government now recommends 1 dose instead of 2, which is a little confusing. What do we need to know about the human papillomavirus, the vaccine?
So this is an interesting topic. I mean, truth is, I think all of this is interesting, which is why I do this. But human papillomavirus vaccine came out probably about 20 years ago. And when it first came out, it was recommended to give to girls age 15 to, I think, 24. And it was 3 doses of vaccine. And early on, we learned, and when I say we, I mean my colleagues who were researchers, but we learned that the vaccine really works well and works better when given earlier. So a number of years ago, the recommendation came out and said, if the child, because when it first came out, it was just for females, now it's for females and males. But if the child gets HPV vaccine, the first dose before age 15, they only need 2 doses. So the recommendation was to move HPV vaccine to an earlier age. And I think, I'm trying to remember back, it was a few years ago, I think the age was 11. So we would start giving the vaccine at age 11. And then we knew when we started doing that even though 11 is good, it also works better if you started earlier. So when our office, and this goes back to recommendations, we kind of jumped the gun on the recommendations a little bit because we knew the research, and a lot of the researchers were saying we should really start this at age 9. So we started doing HPV vaccine at age 9. And parents have been very receptive to that in our office. We knew that once the data came in, it was going to go to the one-shot recommendation. So we were anticipating that the vaccine would eventually go to just 1 dose. So the fact that the CDC did this is, I think most of us think, is a good thing. it also highlights the fact that the vaccine researchers and the healthcare providers don't do one study and stop. We're always looking at things when they come out, and HPV is a great example. Initially, it was at age 15 and 3 doses, and now it's steadily moved earlier and earlier in age and went from 3 doses to 2 doses to 1 dose. So this is a good thing, and this is how medicine and medical science works. We study something, we show, and again, it's my research colleagues, we show that it works, and then we keep looking to see, okay, how do we make this better? And is it doing what we thought it would do? And we find out there's a better way, we adapt, and we go with the better way. So this is what we're doing. The thing with many of these changes and recommendations is there was nothing new to come out and say, change what you're doing. It was more political decisions, not medical science doing it. And that's what the concern is. But with the HPV, that was medical science. It just happened to coincide with the politics, I guess.
So 1 dose is effective for kids at this point.
If given early. So for example,
Gotcha.
I don't know the data if 18-year-old came and never had HPV vaccine, what the recommendations would be. I would have to look it up. But I do know starting it early, at age 9 or so, yes, that would be effective.
Okay, let me ask you about MMR vaccine for measles, mumps, and rubella. This is still on the federal immunization schedule, I think, but we're seeing a growing number of people refusing the measles vaccine, and now we're seeing outbreaks of measles. Are we going to see outbreaks of mumps and rubella too?
The reason we're having outbreaks of measles is based on 2 specific facts. One is that there have been people who either have misread or just ignored the facts that the measles vaccine is an incredibly safe vaccine that's been around for over 50 years. And these folks are concerned that it can cause autism, although the data is so clear that it does not. It's been looked at more than any other side effect in any other vaccine, and probably more than any other medication. It does not cause autism. And in fact, the paper that started this concern was found to be fraudulent. They made up the data. The researchers did it, and it was retracted from Lancet, the journal in England. So people stopped getting measles vaccine because they were concerned about something that did not exist. So that was the first thing. The second thing is measles is the most contagious infection around. It is more contagious than Ebola, than flu, than whatever you want. That if there was a plane full of people and the plane was filled with people and none of them had measles vaccine and none of them had ever had measles, and one person walked down the aisle, just walked down the aisle. By the time they walked up and down the aisle, the majority of those people on the plane would end up having measles. It is that contagious. It is the most contagious disease in the world. So you have less people protected, and those people, it's very easy for them to catch measles. So that's why there's an outbreak, because there's less immunization and it's so contagious. With the other components, the mumps and the rubella, it's not as contagious. So we don't have the same outbreak that we're going to have with measles. It's because the virus is not as contagious. And just to go back to what I said about New York State requiring immunizations, 98% of kids in New York State going to school in New York State are immunized against measles. So New York State has very good immunizations. When we've had the outbreaks it's been, and this goes back to an earlier question about geography, if you will, there are pockets of people that have chosen to not get immunized, and that's a population of people waiting to get infected.
And some people who get measles will recover from it like it wasn't a big deal, but some people will die from it.
Absolutely. In 2000, measles was deemed as being eradicated in the United States. You know, we don't have measles anymore. You don't have to worry about it. And then that was right around the time when that fraudulent paper came out, and there were more and more people choosing not to immunize. And some of those people were exposed primarily through travel. Either you go to another country where there's measles, or someone from the other country comes here, you know, and they stop at the airport, and that's how people get infected. So since then, there have been, and it would vary year from year, there have been little outbreaks of measles. And for last year, calendar year 2025, there were 2,242 cases of measles. And that's from the CDC. So there's a lot of measles. 90% of those with measles were children, 90%. And the vast majority were not immunized. And we also know, even though 2,000 sounds like a lot, there were a lot more that had measles, but purposely did not come forward to tell people because they were people who did not believe getting measles was an issue. They weren't going to call the health department and say, hey, my kid has a measles rash. So we know it's more than that. So of the 2,242 people that had measles, and 90% were kids, 10% of that population, the 2,200, were hospitalized. I mean, 10% is a lot. You know, if you think of Onondaga County has, 450,000 people, if 10% got hospitalized, that's a lot. And then there were 3 deaths in 2025 of children from measles. That's 3 kids who died because they were not immunized. It's very clear cut. They died from measles, they weren't immunized. The measles vaccine is very effective. And they died because they did not get their shots.
So you and your colleagues, the pediatricians, you're spending quite a bit of time, it sounds like, talking about this in detail with each parent. It's harder to do now that there's not government recommendations in place, right?
Correct. It's harder a few ways. One is it just takes more time. And I think it's pretty clear that pediatricians and physicians and most people, we want to do the right things. If things take more time, we spend more time, but it takes more time to do the same amount of work. But the other thing, it gets demoralizing to the doctors and the nurses and the nurse practitioners because we view immunization, but let me back up. When I think of advances in world history, the most important advance ever was clean water. When we had clean water, people were healthier, less people died. And then the second most important thing is access to food. Number 3, I will put on the list immunizations. And there's, statisticians and researchers do these studies every so often, and I love reading them. And it says, this is the number of deaths that were prevented in the last 100 years because of polio vaccine or measles vaccine. Vaccines are a miracle what they've done. When I look at RSV vaccine or Sivimab, and there are others also, we used to admit kids all the time for RSV up until about 3 years ago when the vaccine came out. And many of those kids ended up in the hospital, they ended up in the ICU, and some died. And that doesn't happen anymore. I mean, for me as a doctor, That's a miracle, to save people before they even get sick. And then to have people, and I'm not talking about the parents, I'm talking about those out in the world who are spreading misinformation about this, and to say, we're not going to give these out anymore. It is demoralizing, because this is our life's work, is helping people. If you look at the vast majority of people in healthcare, we want our patients to be healthy. That's why we come to work every day. And that to have people say, no, we're not going to do that, it's demoralizing. I think people should ask questions on everything we do. People should know what we're recommending. They should know what we're doing. That's why we have this show, so people can learn about healthcare, because it'll make them better at making good choices for themselves. I support that 100%. But some of the people who are anti-vaccine, they're not honest brokers. They're not using good information, real data. And I don't think they have my patient's best interests at heart. I have one more thing that I'd like to share with your audience. I don't think anybody who listens to this show to do what I tell them. You don't know me. I'm not your doctor. You don't have to listen to me. But hopefully you have a doctor. And if you have a doctor and you have a question about what to do for your health, you should go talk to your doctor. And if you don't trust your doctor to answer the question, then you have the wrong doctor and you need to get a new doctor. But you shouldn't listen to people on the internet, on the podcast. You should listen to us, but then you need to go and get more information. You need to talk to people you know and people you trust and people who are going to take care of you. And that's the main message I would like your listeners to hear from me.
Well, that's good to know. Thank you for taking the time, Dr. Blatt.
Thank you. I always enjoy talking with you.
My guest has been Dr. Steven Blatt, a professor of pediatrics who oversees the General Pediatrics Division at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.